I could have stayed silent, agreed to the demands, and no one would have known. What the public would have seen were scientists dismissed without cause and vaccine protections quietly eroded, all under the authority of a Senate-confirmed director with unimpeachable credentials. I could have kept the office, the title, but I would have lost the one thing that cannot be replaced, my integrity.
And what did he tell you to do?
In the first meeting,
Yeah.
briefly, in the first meeting, he asked me to commit to firing scientists or resign. He asked me to pre-commit to signing off on each and one of the forthcoming ACIP recommendations, regardless of whether or not there was scientific evidence.
And what were those recommendations? Did you have a foreshadowing of what they would be?
I did not. We did not get into any substance about what those...
He wanted you to approve them.
He just wanted blanket approval.
Okay.
And if I could not commit to approval of each and every one of the recommendations that would be forthcoming, I needed to resign. I did not resign, and that is when he told me he had already spoken to the White House about having me removed.
Did he ever communicate he was going to change the childhood vaccination schedule?
Not until that very day. In that morning meeting, he said that the childhood vaccine schedule would be changing starting in September, and I needed to be on board with it.
Did he ever suggest that he was speaking for the president?
In that morning meeting, he did say that he had spoken to the president. He spoke to the president every day about changing the childhood vaccine schedule.
Okay.
Not for the past decade. I was at CDC.
So this is the first time that's been the case?
Yes.
And in preparing materials for the meeting, were you told to disregard science or to enhance science, or what were you supposed to do?
For the last meeting, we had developed...
I'm talking about this meeting coming up.
For this meeting, we didn't have work groups other than one for COVID. So CDC scientists were being asked by ACIP to develop questions and recommendations. I did suggest additional questions that the hepatitis B work group look at so that they could look at differences in age groups. The senior advisor was concerned that could bias moving away from a birth dose. I asked how asking questions and providing data could do bias if we didn't have the answers yet.
Biased against moving away from, you're suggesting that they wanted to move away from the birth dose, but they were afraid that your data would say that they should retain it?
Correct.
Thinking that every child needs every vaccine, which is what your CDC does. Every child needs every vaccine, all 70 to 80 of them, is certainly a different mindset than Secretary Kennedy's. And that if the university president, I think a great sports analogy, I hate to do this, but the university president and the athletic director decide you're not the right coach for this team, then it's probably time to say goodbye and we need a new coach. Would you agree that certainly you're going in a different direction philosophically than Secretary Kennedy is?
So I will stand behind scientific integrity with every decision I ever make. If I am put in a position of having to say, I will cede scientific integrity to retain my job, then I'm not the right person for the position.
I mean, it's my understanding that before 1991, when not all babies were vaccinated, about 20,000 babies were infected each year, and that after the CDC's recommendations in the 1990s, that dropped by 99%. This terribly contagious disease. And the reason why we test everybody is because certain moms might not have been tested and don't know that they have it. So is there anything else you want to add? Because I know this has come up numerous times.
I think those are consistent with the information that I have associated with hepatitis B, and it's the promise of the vaccine.
Dr. Howry, do you believe that a change to that recommendation on hepatitis B vaccine at the advisory committee meeting this week would be based on an objective, comprehensive review of data?
So if the vote is to change it to age 4, then that would not be based on data.
Yeah.
For those who say, why should a child be vaccinated for a sexually transmitted disease when they're at birth? The child passes through the birth canal and is exposed to the same secretions as one would otherwise. And that passage through the birth canal makes that child vulnerable to the virus being transmitted. Not just hepatitis B, it can be HIV, it can be other things. But in terms of hepatitis B, that happens. If that child is infected at birth, more than 90% of them develop chronic lifelong infection. And by the way, as Dr. Monarez says, this doesn't mandate. It doesn't say you can't leave the hospital unless you get it. It just says that if the mother accepts, then the insurance company has to pay. It's not mandated. It's just like, mama, if you think it's a good idea, accept it. In the decade following approval of a birth dose of hepatitis B, newborn infection of hepatitis B reduced by 68%. That's in the decade, so that's up to 2001. Now, fewer than 20 babies per year get hepatitis B from their mother. That is an accomplishment to make America healthy again. And we should stand up and salute the people that made that decision. Because there's people who would otherwise be dead if those mothers were not given that option to have their child vaccinated.